Hi there. Thank you for joining me once again as we continue our conversations around the COVID-19 pandemic. I'm Dr. Mahendra Carpen. I'm the head of medical services at the Georgetown Public Hospital Corporation, and it is my department that deals with all the patients admitted with a diagnosis of COVID-19. For the rest of this conversation, I will take my mask off so that you could better understand me. There's no one else within 6 feet of me here, so I'm not being exposed, nor am I exposing anyone else as we have this conversation. Remember, if you have questions, you may send us a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. We'll be very happy to address your questions related to the COVID-19 pandemic. So today I wanted to remind you, and we wanted to have a further discussion on the clinical aspects of COVID-19. This condition has been around now for almost a year. In Guyana, our first experience of this was in March 2020 when we had the first patient presenting to the Georgetown Public Hospital emergency room and subsequently dying. Following that, we have had an increase in the number of cases who are positive as well as the number of patients who unfortunately died. So it is important for us to remind ourselves about all of the possible clinical aspects and situations that are present in the COVID-19 pandemic. By the time patients come to hospital, that is not the beginning of their exposure or their infection. Let us assume that persons come to hospital because they start to feel sick. That's not when the problem starts. The problem actually would have started almost up to 2 weeks before this. About 2 weeks before patients come to hospital, that is when usually the exposure happens. At that point, they would have picked up their infection about as long as 2 weeks before, sometimes as short as 7 days. But that's when they pick up the infection. From then to the time they come to hospital, there is what is known as an incubation period. The virus in the body starts to grow, starts to reproduce or replicate itself, and then fever starts about 2 weeks after, or 1 to 2 weeks after exposure. So if we consider that that is day 0 when symptoms start, then when fever starts, your body is then mounting a response to fight off this virus. It does so by creating what we call antibodies. These are your body's natural defense mechanisms that are created in the face of an infection. There are 2 main types of antibodies that are produced: the IgM, or immunoglobulin M, which happens immediately as the symptoms begin. And then there is the immunoglobulin G, the IgG, which starts like about a week after, and it persists for much longer. So checking the blood of these patients, depending on the timing of the test, you may or may not find positive antibodies, whether it's IgM or IgG. We need to remember that patients present with varying severity of symptoms. Some persons may have quite mild symptoms. They don't even recognize that they are not well. They don't even recognize that they may have coronavirus. And then there are others who have progressively worsening symptoms. So it can range from mild to moderate and then severe. The severe patients are those who really cannot maintain good oxygen saturation in their blood while breathing in normal room air or atmospheric air. Those are the persons who are going to be needing admission to hospital. So the common symptoms that are associated with COVID-19, the most common one is fever. Then we look at things like coughing. There is shortness of breath or difficulty breathing, chills, muscle pain, headache, sore throat, a new loss of taste or smell, congestion or runny nose can happen, nausea or vomiting. These are all possible in the COVID-19 patient. And as we move more and more into the usual annual flu season, which usually happens November, December up to March, this is when we are going to also see an increase in the number of flu patients. And there's going to be a lot of overlapping symptoms, and it's important to understand that it could be either one or the other. And there's a reason to be concerned, because the worst of the two, the one that affects you the most, would be COVID-19. There's higher mortality rate, higher admission rate, and people can get a lot sicker. And it's also possible for the COVID-19 patient to infect a lot more persons than those who have the actual flu. For the majority of persons who get a COVID-19 positive exposure, these persons go through a pretty well understood, well set evolution of this process. There's the incubation period which happens, and they develop symptoms between week 1 and 2. As mentioned before, the symptoms do not start at the time of infection. Symptoms can take about 1 to 2 weeks after infection before the symptoms show themselves. So it's very important to understand that concept. Patients themselves who are then symptomatic can also now become potential sources of infection for others with whom they come in contact. And this is worse from the 2 days or 48 hours before they actually develop symptoms, and it can persist all the way from up to day 8 to day 10. That is the most highly infectious period where this person can then transmit the infection to others. The general course of the infection or illness can last up to 2 days, sometimes up to 10 days, or sometimes up to 2 weeks. And by the time you get to that 2-week period, the majority of persons would have recovered the most of their senses again. They would have recovered taste, smell. They would have recovered from fever, body aches, fever, coughing, shortness of breath. All of those things they would have had recovery from by the end of 2 weeks. So it's important to recognize that that is the common majority of cases. But there are some, the more severe patients, that have a different evolution. These are persons who would require hospital admission. And so from day 1 of infection, these persons can then more rapidly develop symptoms. And by day 6 or thereabouts, they can then develop symptoms which start to show up. And the really sick ones can get admitted to hospital after a week. And if they continue to get worse, the natural course is for them to be moved to the ICU just before the 2nd week. And if they're going to recover, the majority would be out of hospital before the 3rd week. This is data that was first observed in China, where the virus was thought to have started in Wuhan. So there is enough evidence and confidence to actually believe that this is what actually happens in the more severely ill person. As we are recognizing, this virus can actually affect you from head to toe. And this is quite concerning. At the beginning, we thought it was a respiratory virus, and so its effect would be mainly in the respiratory system, affecting the lungs and causing shortness of breath, etc. But we now know that it can affect the brain. It can affect the kidneys. It can affect the heart. It can affect your pancreas. It can affect your muscle fibers, and that can cause extreme weakness and fatigue. In the heart, it can cause something called myocarditis, or inflammation of the heart muscle, that can lead to weakness in the performance of the heart's function, and that allows fluid to build up in the lungs, and another reason for people to get short of breath. So in the brain, it can also cause swelling of the brain and long-term effects. There's actually an increase in strokes in patients who have COVID-19. There's also the possibility that there's increased formation of clots in the lungs that can cause what we call pulmonary embolism. So this can happen in many patients. Fortunately, it doesn't happen in all patients, but there is a percentage of patients that will have significant effects at the time of infection, or even effects that persist after the infection. The most vulnerable group among the population is the elderly, and we see the effects in the population getting progressively worse as you get older. So for example, children who are about 0 to 4 years old, when you look at the rates of hospitalization, they're less than 1% per 100,000 population. Whereas if you get to the over 85 years old person, more than 17 per 100,000 population were hospitalized with a positive infection of COVID-19. The majority of our population in Guyana is between 50 to 75, and we have seen that true as well, that is the higher percentage of our hospitalized patients. The treatment in hospital is mainly supportive care. We have known for some time, and we've been looking for appropriate specific treatment, but as of now, there is still no magic bullet, no specific treatment for the COVID-19. Supportive care is most of what we can offer persons, along with some medications that we hope can continue to show some kind of benefits in these patients. And what do we mean by supportive care? Essentially, it's proper hydration, nutrition, if you have fever, things to reduce fever, and those kind of things that we provide to patients. So supportive care, and the majority of persons generally will do well. If persons are in hospital, however, and they need medical treatment beyond supportive care, there are options that we have available that we have tried with varying success. And we are learning more and more about the suitable and successful treatment options, when to use them, who to use them in, what are the appropriate use criteria, when not to use these medications. And so we have gone through a set of medications and therapeutic interventions, and we continue to use a lot of them. These include things like convalescent plasma, and the one that has been shown to have significant benefit in hospitalized patients is the use of steroids. We use dexamethasone as our steroid of choice, and this is the same steroid that was shown in the major trial in the US at Oxford University to be of benefit. Other things that we use include antibiotics, and this would be like azithromycin or doxycycline. And of course we have the antiviral remdesivir, which we continue to use in early stages of this infection. Ivermectin is also a possible choice for us to use. Hydroxychloroquine, not so much these days as we had been using in the early stages of this pandemic. And of course the other things such as vitamin C, zinc, vitamin D, etc. These are all known supportive medication that can help. There are symptoms that can persist beyond the acute phase of this infection, and these are things like fatigue, and lots of persons would have reported extreme fatigue, but there's also things like breathlessness, joint pains, chest pain, etc. that can occur in these patients. Most people who get the COVID-19 infection will recover from it. The majority of persons who get COVID-19 will recover from it. There is another fact. You can recover from coronavirus disease, and catching the new coronavirus does not mean you will have it for life. So if you get it, it doesn't mean that you will have it for life. So those are two key facts that we should remember. So I want to thank you very much for joining me again today. And remember, if you have questions, you can send them by WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thanks again for joining me.